Good morning, Mrs. Smith. My name is Lydia. I'm going to be your student nurse today who will be administering your medication to you this morning. This morning I will be giving you your Doxorubicin. This medication is going to be given to you for your acute lymphoblastic leukemia. This medication has been newly prescribed to you by your provider, so I wanted to go over some patient education points with you today before administering you this medication. So Doxorubicin, or otherwise known as andromycin, is given to inhibit DNA and RNA synthesis in your cancerous cells. This medication can also be prescribed for various other types of cancer, such as breast cancer, bladder cancer, Hodgkin's lymphoma, non-Hodgkin's lymphoma, acute myeloid leukemia, and many other types of cancers. But today we will be administering you this medication to treat your cancer diagnosis of acute lymphoblastic leukemia. I will be pushing this medication through the port in your IV, and I will be sure to push it over the span of 3 to 10 minutes. Before administering this medication, I just wanted to confirm your allergies and make sure that you're not allergic to Doxorubicin. You're not allergic and you've taken this medication before? Okay, that's perfect. I also wanted to make sure that you are aware of the possible adverse reactions that you may experience during or after administration of this medication. Since I will be pushing this medication through your IV, there is a risk of extravasation. Extravasation occurs when a medication that is supposed to go into the vein leaks out into the surrounding tissues, and this can cause pain, swelling, sometimes tissue damage, which can be pretty severe. So it is very important to notify me right away if you feel any of these symptoms coming on, or any changes in this IV site and the tissue surrounding your IV. Because there is a risk of extravasation, I will be assessing your IV every hour. And during administration of this medication, we will also be closely monitoring your heart and its function, as this drug can sometimes be cardiotoxic and cause dysrhythmias or abnormal heart rhythms. A co-medication that can be administered to you is dexrazoxane or Totec. In the event that extravasation does occur, we will administer you dexrazoxane to manage the extravasation. Dexrazoxane also protects against cardiotoxicity, so it's just a really great medication to give if you experience any of these side effects. Another adverse effect of this medication that I wanted to make sure that you were aware of is that it can cause alopecia or hair loss. This usually is a temporary loss of hair after treatment. Your hair should start growing back. This occurs because medications like these attack fast-growing cells, and hair cells are very fast-growing, so they tend to be attacked by medications like these as well. During treatment, we will also be monitoring your CBC, or complete blood cell count, with differential labs, as well as platelet counts. I believe we have record of a baseline ECG for you that will help us monitor your heart and recognize if there are any changes that could indicate cardiotoxicity. I know this was a lot of information, but does that sound like a good plan to you? Perfect. Do you have any questions or concerns for me today? No? Okay. I will start preparing this medication for administration then.